Thank you. Thanks for the opportunity to be here. So I'm going to talk a little bit about beyond the ROI. And this came about, I have a new position. This Chief of Behavioral Health position at Blue Cross is new over the last 9 months. And I was brought on really to build and develop our behavioral health strategy. And we have a very thoughtful and appropriately judicious CFO. And so I am steeped in on developing the business case for investments in behavioral health. And this audience understands that the business case for investing in behavioral health is very similar to the business case for investing in social determinants and the non-medical social needs for people. So we thought that the real life experience could be helpful here. So first point is sometimes a positive ROI is not enough, and that's the point that we've made several times today. And this really came, in my field in behavioral health, we've had the positive ROI argument for at least 2 decades, and I've worked in Medicaid, I've worked in health systems, tried to push this agenda with the economic argument, and it's about 5 years ago it became clear that it's not enough. There's many more things that contribute to, beyond the economic argument, that contribute to whether an organization is going to invest. So what are some of those things? And this really echoes, again, what we've talked about this morning. So the funder, be it the federal government, a state, an insurance company, a granting organization, that funder has many people like us coming to them with interventions that have ROIs. So it's really important for us to be able to articulate how our intervention and our ROI stacks up against all the other potential interventions. That point that was made at the last talk about the funding entity having responsibility for the outcome, we have to make sure that that group we're going to is actually going to be the same organization that realizes the savings, and if they're not, we've got to be able to account for that. The number needed to treat argument point is really important. So being able to articulate what is the burden of this social need in this population, and then being able to walk that funder through the whole thing, that this intervention is going to be delivered to that population in a dose at the amount where you're actually going to see that change for improvement in health that's going to lead to that cost savings at the scale that you're expecting. And that's key, and it all starts with understanding the prevalence in the population. But being able to walk through that process is key for convincing a funder. And that's one of the challenges of social determinants and the non-medical social needs, is that a lot of times we aren't screening, and we don't actually know what the true burden or the true prevalence is in the population that we're trying to address. And this point was also made that even if the ROI is low, if you've got a CEO who's on board, if you've got a legislator who's on board, then that economic argument can be cast in a completely different light. So what are the challenges? And I think this is what we'll get into in our discussion. So at Blue Cross, we're building alternative payment models for behavioral health, and very dedicated and focused on addressing the social needs of this population, understanding that if we do that well, we're going to see the health outcomes that we want. But how do you actually pay for these interventions in a value-based model? Is it actually you're paying, using the medical expense to that clinic, but that sort of assumes that that clinic is doing all of these interventions, which in reality, they're probably more likely partnering with community-based organizations. Do you use a model where you're sharing savings? But then you get into the situation where you may have 5 to 10 to 15 entities that are contributing to health for this population, and you're distributing the savings, and then the financial incentive really is kind of lost. Or do you do what we talked about today? Use your savings, if you're a nonprofit, your foundation money to be able to build that infrastructure so that when you're paying that provider in that value-based reimbursement model, that partner, that community-based partner, is there for that provider to draw on to address that social need leading to the health change that we want. So I think those are the different approaches that we're thinking through. All have pros and cons. Really being able to deliver on social determinants at scale is a challenge. So if you think about in North Carolina, in many states, we've got urban areas, we've got rural areas. There's many different kinds of community-based organizations across the state. How can we, across this population, really trust and believe that we're paying for these interventions at the appropriate scale, that we're getting the quality, that we're actually meeting the needs that are there? And that's really hard to do because it's hard to measure the quality, and it's also hard to determine, who's doing which services and in what way. And then, every population is going to have a different type of or a different mix of social determinant needs. And so figuring out the payment model that accounts for really all of the different types of needs that population could have, and doing that again at scale across a large geography is a challenge. All right, I'm ahead of time.
Well, good. I'm going to ask you extra questions.